はい、皆さんこんばんは。スマートシティインシティュートの南雲でございます。今日も大変お忙しいところ、このベビダーにご参加いただきまして、誠にありがとうございます。ですね、今日は、月曜日に続いてといいますかね、実は10月の23日に日経ホールで大きなイベントをやりましたけど、その時からの連続になるんですけども、リバブル&ウェルビーイングシティの指標ということで、オーストラリアのですね、メルボルン工科大学との中継で今日はやります。前半はですね、初めからあらかじめ撮ってある映像で、メラニーさんにですね、オーストラリアの事例ということで、彼らのモデルについてのご説明をいただきまして、で、その後、いわゆるいつも言ってる、ディスカッションってやつですけど、ここはもうライブでやりますので、で、これ、特に同時通訳みたいなものは入れてないので、僕と、それから事務局の工藤さんがバックにおりますけども、2人でですね、日本語と英語とバック&フォースしながら、今日のディスカッションをやってみたいと思います。ということで、これからメラニーさんのですね、映像を流しますけれども、皆さんね、質問とかね、コメントとかいつもの通りチャットでいただければと思うんですけど、もう英語でいける人はですね、遠慮せず英語でやってください。毎回訳すとですね、ロストイントランゼーションになっちゃう可能性もあるので、細かいニュアンスみたいなのも含めて考えますと、英語で聞ける人は英語で書いていただくというのが一番自然かもしれません。もちろんね、日本語でっていう人は日本語でやっていても、僕ら頑張って訳しますけれども、という形でいきますかね。こういうレアなオケージョンもなかなか面白いかと思いますので。じゃあ、事務局の方からですね、これから、映像を流してもらいますので、それをご覧になってください。はい、よろしくお願いします。
Hello everyone, I'm now going to provide you with a presentation today to talk a little bit about how we're using indicators here in Australia, particularly within the Healthy Liveable Cities group in Melbourne at RMIT University. Before I begin my presentation, I'd also like to acknowledge that I'm providing this presentation to you as I sit on the people of the Woiwurrung and Boonwurrung language groups of the Eastern Kulin Nations. On those unceded lands, we conduct the business of the university. RMIT University respectfully acknowledges their ancestors and elders past, present and future. So thank you for the opportunity to talk a little bit further about what we're doing across in Melbourne and over Australia. And I'm going to concentrate this presentation more on some background to how we got here, but then to concentrate further on how indicators can be used in policy and planning and direct application. So to start with, I think it's really important to think about, we hear a lot about the use of technology and how smart cities are really driving the way of the future. And there's a couple of examples I've just got on screen at the moment that talk about the use of digital twins. These are really, amazing technical abilities that come at the moment in terms of building these kind of replicas of the current cities. And just recently in Australia, Sydney, particularly Western Sydney and New South Wales, around Sydney, they have developed and they're launched or released the Spatial Digital Twin project here with the CSIRO and also Data 61. And the reason that I bring this up to start with is really just to think about the theory and ideology that sits behind smart cities, because technology changes rapidly and we can do a lot of things in terms of the use of data, the new availability of data, the use of Internet of Things and so on. But I guess one of the things to really think about here is what guides the use of this technology and what guides the production of smart cities. And previously, I've sort of thought about some of these issues and talked about whether or not smart cities are always kind cities. Are they ethical cities? Are they equitable cities? So the use of big data and artificial intelligence to manage cities creates many ethical issues. And I think if you'd like to have a look, there's a great article up there by Rob Kitchen at Maynooth University in Dublin, or in Southern Ireland anyway, that you can go in and look at his piece, because it's really contentious when you think about some of the reasons and the ethics behind, I guess, ethical innovation. So something to think about there. Also, I do know this person here who is over in the US, and she has a nice simple conversation article that talks about smart cities that benefit everyone. And it's really this idea of bringing equity back to the conversation, which hasn't always been the case in the use of data and perhaps is lost from some of the conversation. Even in terms of the use, the collection, the production of data, all of these things are really important to think about. And I think that Cambridge Analytics is a good example of perhaps how we could do things wrong, but also acknowledging that when some of these things were first created, we didn't really think about the big issues that came with it. So just some ideas to start with there. I'm now going to take you back into the indicator land, as I would think about it, within Australia, and tell you a little bit about how we came to have a national indicator system through the Australian Urban Observatory, which I'll tell you about shortly. But really our work in Australia with the indicators first came with this Victorian project, so one of our states, the southern state of Victoria, and Community Indicators Victoria, which really operated from 2007 to 2017. And I was a part of this team that really created this new indicator system across the state. We covered all 79 local government areas with a range of both objective and subjective measures, so survey data, administrative data, and GIS or spatial data, which we started using during this time. And then things really have moved on since. And that led to the beginning of the Australian Urban Observatory. But one of the things when it came to, I guess, this interest, and my interest in particular in terms of Community Indicators Victoria, I came in from that social lens. Working within public health, we had this project developed and we really tried to sort of set the agenda across the state in terms of using evidence for good, bringing data to this conversation when at this time, back in 2006, 7, 8, nobody really wanted to share data across our state. It was a very highly protected resource, whereas now we've moved into a whole different time, and this is where the kind of connection comes in later on. But we had this broad framework that we were seeking informed, engaged, equitable and well-planned communities. So 5 domains that broadly covered across social, economic, environmental, cultural and democratic measures of well-being that we provided for free out to the state, to the local government or municipal areas across Victoria. And this became really a well-used resource. It was funded by the Victorian Health Promotion Foundation, Vic Health, and was something that, really did make a difference in terms of the way that data and information started to be planned. In terms of the expansion, I guess some of the use of that Community Indicators Victoria evidence came through a great PhD produced by Jeffrey Brown. And you can see to the left here is an example of one of the papers Jeff produced through his PhD, which found that people really were using the evidence provided. It was one of the 4th most cited sources of evidence in municipal public health and wellbeing planning across the state. So Jeff spent his PhD looking at the use of evidence in planning and the indicators being used within CIV. So that's something you can always go away and look at. But around this time, back to around 2013, say around the time when Jeff was starting to really look, we wanted to understand application and use of indicators. I was also involved in a project that looked at key indicators for Melbourne neighbourhoods. And this is where the beginnings of Liveability really started. So in the past, in community indicators, we talked about community wellbeing, but we became quite interested in Liveability and how that was an important influence. That report actually came up with the key definition of Liveability that I'm going to show you in a moment on screen, but also we were able to identify some of the, the key lessons of how we could take these indicators, how we could map it to a Liveability definition, and how that closely aligned with the social determinants of health. So here is our big, long definition of Liveability, but I'd say it's also quite comprehensive. So we say a safe, socially cohesive and inclusive place that is environmentally sustainable. It has affordable and diverse housing linked via public transport, walking and cycling infrastructure to employment, education, public open space, local shops, health and community services, and leisure and cultural opportunities. Now, this is a really big, broad definition, but I would also argue that it's the sort of thing that you're looking for when you look for a place to live in general. Most people are looking for these kinds of things. Why is it important? We think it's really important because it connects directly to the social determinants of health. You can see these models up here produced by Dahlgren and Whitehead back in their seminal work of 1991. And also Barton and Grant in 2006. And these diagrams and this understanding really says that health is broader than illness, that where we live, where we learn, where we're born, where we play, where we age, all of these things influence our later health outcomes. In Australia, we know that the leading cause of death is rising obesity and physical activity. Also, we know that dementia and Alzheimer's disease is the second leading cause of death in Australia. So we have an ageing population as well. In Japan, the leading cause of death is cancer and heart disease. So these are factors that are really strongly influenced by things like where we're living. It's individual lifestyle factors, it's social and community networks. It's also about the food that we have, our education, our work environments, our living and working conditions. Are we unemployed? Do we have access to employment? Do we have access to healthcare services? To a proper housing? Do we have access to buildings and places within the built environment? Do we have access to our natural habitats, air, water, land, green spaces? So these things are really important in terms of our longer term health conditions. Also, just to give you an example of why this is important, it's not just those outcomes of health or illness, but the prevention side of health, which gets much less funds or funding in terms of health budgets than, say, promotion is getting much less money than it is in terms of health outcomes. And we know that even looking at this study here, extrapolating across Europe, health benefits from cycling are estimated at up to 136 billion based on 2017 prices on an annual basis. So it's huge if we can make it easier for people to be active in their everyday lives as well. So now I'm going to just briefly introduce you to the Australian Urban Observatory, which is the lead on from Community Indicators Victoria, where we really wanted to push this work into a national space and really concentrate on the spatial or place-based foundational indicators that connect to the social determinants of health. So within the observatory, I would encourage you to look at this, and I'll provide you with the website address later on again. It's auo.org.au. The observatory itself was launched in February of 2020. It's a digital planning platform transforming complex urban data into livability indicators. So we take complex information, we analyse it, we spatially analyse it, connect it to place, and then map this across Australia's 21 largest cities. It provides observation and understanding of the important social, economic and environmental issues using indicators that go down to both a municipal, to a suburb and to a neighbourhood level. The idea is really to provide our understanding of livability. How do you measure it? How can you understand it? How can you make it easily understood for others? And a key part of this project is really to take all the research that we're doing over the long time period across at least 8-9 years and to turn this into indicators that have been tested for health outcomes and to translate that research knowledge into something that's very easily understood in an online portal, a digital portal, so that can be taken into practice to really change the way that we're planning, use evidence and create real-world impact. Why is it valuable? Is this a tool that's particularly useful? It is livability indicators designed to inform policy, planning and practice. They design effective policy outcomes so that you can find the best place to create that intervention and save money, time and people resources. So you don't need to go and hire within a local government or municipal organisation 10 people to go and do this annually when you can just log in and access it yourself. The other important aspect is we want people to take these indicators, this information, to engage with their communities so that they can actually understand with residents what's important and not just tell residents what they're going to do with the information, to create that shared vision of where is this community going and what is the progress for the future. In terms of measuring livability, we provide a livability index, a walkability index, social infrastructure index, transport, food, alcohol, public open space, employment and housing. And just to give you, again, a bird's eye view, instead of providing an online example, I'm just going to show a few screenshots that actually show you what we have in the observatory. You can see this is actually a map of Sydney in Australia, and I've actually got the example up here of the livability index. So we map that across, first of all, you can see local government areas or the municipalities of Sydney, Greater Sydney, the city. And in the corner, we've got the actual area highlighted for you. In the top right corner, you can see the livability index. Now, we could do this down even further. So we can go either at the suburb, LGA or neighbourhood level. And I've highlighted that in red here. So SA1 refers to the neighbourhood level, which I'm showing on screen at the moment. So this is the livability index for Sydney, and it's based down to around a neighbourhood of around 400 people. So these are very small areas. And you can see within the results that not only do we provide the livability index, but we've also got a number of different pieces of information on screen. First of all, we've got some information for all of the actual indicators we include. So you can look at livability with the rest of these areas or domains of livability. We've also got some Australian Bureau of Statistics census information, which we're going to build further into the portal. And also here, there is quite a range of, in terms of the area of this portal as well. So it shows you the actual location that you are clicking on. So that just gives you a sense of what this feels like when you look at it. And now I'm going to give you some examples of how you can apply this sort of information in practice. And this is really aligning urban planning with public health. So in terms of international context, of course, one of the key things that we can think about in the use and application of indicators is the contribution to the Sustainable Development Goals. And there are a number of these goals, and I would not imagine this is the first time that you've seen these. I'm just going to give you an example, though, of why indicators and measures, the livability indicators we have in the Australian Urban Observatory, why they are important. So this is actually from Goal 11, because we know that there is a number of goals with a number of targets. So there's actually 196 nation states that have joined up into these the Sustainable Development Goals through the United Nations, and also a number of targets for each of these goals. And the two highlighted on screen show that in terms of an exact target for Goal 11, by 2030, there should be universal access to inclusive, accessible, green and public spaces, in particular for women and children, older persons and persons with disabilities. That there also should be, in terms of a target for sustainable cities and communities, there needs to be positive economic, social and environmental links between urban, peri-urban and rural areas by strengthening national and regional development planning. So that's just the example within one goal, Goal 11, Sustainable Cities and Communities. How do we know we're achieving these goals? This is the role of indicators and where they come in. If we're going to be improving access to spaces, we need to look at where we were and where we're going. This also relates to Goal 17, which is really how to work in partnership to achieve these Sustainable Development Goals. One of the key things, and you can see these boxes are highlighted, is to work in partnership together to achieve the goals. A second one is the data monitoring and accountability. So we really need to work on the measurement and understanding so that we can see that we're coming towards these goals. We need to be working so that we can find disaggregated data. We can think about in terms of space, in terms of people, in terms of geographic location and those sorts of things. This is really important to meet these goals. If we're not measuring, I wouldn't say it's not important, but we just don't know where we're heading. So that's where the role of indicators comes in. This is an example of the National Cities Performance Framework within Australia, and I'm just going to go briefly through it. Again, you can look up the National Cities Performance Framework that's online for the Australian Government, and note that there are a number of sustainability and livability indicators. The RMIT team that I work with at the Healthy Liveable Cities Group has provided 2 of these indicators that measures at the city level a number of different issues. In particular, the ones that we have provided look at dwellings with access to public open space. You can see here over in the right, looking at the 21 largest cities across Australia. These cities, as you've heard before, also match the same 21 cities included in the Australian Urban Observatory. So although these indicators measure at the city level, ours go down to measure at the very detailed suburban neighbourhood levels. So the 2 we provided from our team at RMIT are access to public open space and access to public transport, including frequent transport as well. So that's just an example of how they're used, I guess, in a policy and practice sense. At a national level, understanding how are our largest cities performing in these different areas. Excuse me. Now, this is a state-based level. Within Melbourne, we have the Plan Melbourne, which is really a strategic development plan for our greater city, which is home to about 6 million people. Across Melbourne, the 20-minute city, or the 20-minute neighbourhood, I should say, has been discussed and really promoted through that Plan Melbourne work. And you can see, looking at a number of these things, these are indicators we include within our Australian Urban Observatory, down to that neighbourhood level. So do people have access to shops? Do they have access to facilities and services, to schools, to playgrounds, green spaces, sport and recreation facilities, to walkability, to ageing, to housing, to public transport, to local employment? These are all the sorts of things that we're measuring. This is a really nice way of trying to get people to think about the idea of where you live, you should be, say, within 20 minutes of all these types of services. Now, that also is really relevant to health, because we know that if people can get access to these things locally, it makes it much easier for them. They're more likely to engage in enough physical activity if they're using walking or cycling or public transport. You put these things a long way away, and then people tend to be using their cars more. And that's what we see in Australia, and it is a key influencing factor in terms of public health, obesity, heart disease, diabetes type 2 and those kinds of illnesses. So we don't want to see that happen. Now I'm going to give you a more local example of how indicators are used in policy and planning. So here's the Victorian Public Health and Wellbeing Plan, which is developed every 4 years for Victoria, and all municipalities across the state must produce a new plan that actually talks about how they're going to use evidence to inform their future strategies. So in terms of that work, I'm going to share with you an example from Greater Shepparton, which is a regional council. It's doing some great work up in northeastern Victoria. Often we talk about great examples within the cities. So I have spent quite a bit of time over the past 3 years looking at regional livability, and I think it's nice to concentrate on a great example happening in a regional area. Particularly, across Japan, there's a number of regional centres that are really important, and regional areas. So instead of just concentrating on the big city or the biggest, I'm going to now concentrate on this more regional centre of Victoria. So within the local government perspective, all 79 of those need to produce a public health and wellbeing plan that aligns to this state health plan as well. And here you can see the use of indicators has been very useful in terms of the development of a 10-year public health strategic plan for Greater Shepparton. And much of this is available online, so I'd encourage you to go away and look if you're interested. So here's my little map of where Shepparton is located. You can see here is Melbourne down the bottom. We can see Sydney right up the top on the right here, and Shepparton really sits, and there's Canberra, our capital of Australia, in the middle of Australian Capital Territory. You can see the red dot is Shepparton. It really largely sits halfway between Canberra and Melbourne, and it is a large regional centre. In terms of what we have done in partnership with Shepparton is to produce a range of indicators. This is before we had access to the Australian Urban Observatory. It was in development at this time. So we actually worked with them to say, what are some of the things you really want to know about? And you'll see that a number of these indicators align quite clearly with what we have in the Australian Urban Observatory. So these is the list of indicators available. You can see we have walkability, housing diversity, public transport, access to food, both healthy and unhealthy foods, access to services of daily living, distance to nearest public open space, unemployment, local employment, education, particularly the completion of high school level education, access to doctors or general practitioners, access to services for older people, an indicator we've created previously, and the socio-economic index for areas produced by the Australian Bureau of Statistics, which gives you an overall index for relative disadvantage by areas. So in terms of that information, the Greater Shepparton City Council were able to take the indicator results and combine that with some other information that they had internally themselves, and really were able to turn that into their 10-year public health plan. Within some of these goals that they really came up with, what they wanted to do within that plan, one of the key outcomes, and I've got a couple as examples here to present, includes the outcome that Greater Shepparton residents would act to protect and promote health. This is their outcomes framework. Their targets to decrease annual gambling expenditure. Gambling was one of the indicators we measured. Decrease the net value of electronic gaming machine expenditure. Increase access to general practitioners per 1,000 people from baseline of 1.4, and decrease the prevalence of overweight and obesity from baseline of 58.7%. Around the area of Shepparton, one of the greatest issues that they're also tackling is some of the difficulties that they're having in terms of childhood obesity rates. So there's a number of universities that are working together across that area, but that's obviously influencing that decrease of overweight and obesity too. In terms of their implementation plan, so they've taken that overall goal and turned that into an annual implementation plan where they've actually got targets, looking at what they're going to do, what they're aiming for, and how does it affect, who is it led by within the actual council area, what's the source of the information they're going to use, how are they going to measure change over time to understand that they've made differences. So this is a really nice example of how you practically turn it into something that is useful for people to use in terms of policy and planning. A second example that I provide from Greater Shepparton Council in terms of their health planning is that they wanted the outcome of Greater Shepparton residents having access to safe walking and cycling routes and reliable public transport options. So part of our research really did show that there was quite a number of areas on the outer growing areas of their town that had poor walkability, particularly poor school walkability, meaning that kids weren't really able to get to school using active transport, which obviously is going to influence their diabetes and obesity and longer-term health outcomes. So in terms of their targets, they wanted to work towards creating higher primary school walkability, secondary school walkability, so that they would have an 800-metre neighbourhood road network buffer around primary schools in terms of their improving their walkability, and a 2-kilometre walkability buffer around secondary schools. And also really walkability for transport in general, working towards creating townships to provide land use mix and services of daily living, road connectivity and housing density. So within our livability assessment, we really looked at those 3 components that create walkability, and they have then sought to improve that across their townships within that municipality. And finally, again, they have an implementation plan for that outcome, where they've got an actual target, then talk about the actions or strategies that are going to inform that target, the performance measure to understand how they're going in achieving that, who would lead it across the council or municipality, and what was the time frame that they expect to actually see these changes occur. So a great example of how you could take that policy and turn it into something that's measurable, it's actionable as well, using indicators. So in terms of overall planning outcomes from indicators in Greater Shepparton, I've just tried to summarise some of those into one scheme, one slide that talks about both the public health and wellbeing planning and strategic planning outcomes. So they've taken the indicator use and results. It's influenced their public health strategic plan from 2018 to 2028. That's the 10-year plan. It's influenced the council plan from 2017 to 2021. And it's also produced an annual public health implementation plan. In terms of their strategic planning, it has influenced their regional city growth that has been developed in association with the Victorian Planning Authority. In terms of that work, there's been 6 outcomes to drive Shepparton into a thriving regional hub, including an outcome to create a city of livable neighbourhoods, directly related to the application and understanding of those livability indicators. It has influenced the Shepparton Railway Precinct Master Plan, with acknowledgement from the indicator results that this train or the regional rail hub was a long distance from a lot of houses with poor walkability connections. That has also influenced the Shepparton Health and Tertiary Precincts Action Plan. There's a lot of hospitals and universities in this regional centre, and the Shepparton North East Precinct Structure Plan and Growth Plan for the area of Toolamba. And really, has supported this informed, engaged, equitable and well-planned communities, which is great. Finally, the last example I would like to show you is another municipality who has done some great work in terms of their livability plan over quite a number of years. And I'm quite pleased to say that there's, you'll see in the bottom left side, we've just recently produced a book chapter to summarise the great work that's happening at this Shire of Cardinia. So you can see in the top left, there's a nice little map of Melbourne, and that highlighted area shows you exactly where Cardinia Shire is. And it's actually a growth area council in the southeastern area of Melbourne. And across the last, since started from about 2016 up to date, there was a released Cardinia Shire Livability plan in 2017 that had quite a 12-year plan that looked at the use of indicators in terms of neighbourhood livability. They were able to understand what were some of those issues, and they really took this understanding of livability that we had shared, took that into their health and wellbeing planning and linked that into their council planning as well. So you can see in terms of the vision for that area, that municipality, they said that Cardinia Shire would be a livable, resilient community where the environment flourishes and residents are healthy, included and connected. And then they broke that down into outcomes. So what would they measure over time to understand that they had achieved this vision? The outcomes around mental health and well-being, improving social cohesion, safety, reducing obesity, reducing family violence, reducing family vulnerability, and reducing harm from alcohol, tobacco, drugs, and gambling. These all link to the livability policy domains of active travel, education, employment, food, health and social services, housing, open spaces and places, and then connected through social equity, leading to their action agenda, community grants, community participation, and now the phase that they've moved into, which is monitoring and evaluation of this long-term plan. So if you're interested in hearing more about what they've done, I really recommend that you go and look at this highlighted community quality of life indicators. You can look at the chapter they've produced and learn more about their great work. And I can't say enough about how wonderful they've done in terms of really embedding evidence and worked across their organisation and with partners external to come up with wonderful outcomes for the community. Oh, there we go. There's the lovely book if you're interested. I was happy enough to work on this book with my co-authors, Chanel Stevens and Frank Rizzi. We all work within the Community Indicators Consortium on the board for the consortium and have been supporting the work of community indicators for some time. And that's it. That's the end of my presentation. Thank you to the Mitsubishi Foundation for allowing me to provide this presentation to you. And I encourage you to go away and have a look at the website highlighted, auo.org.au, to learn more about our work. So thank you very much.
はい、ということで、メラニーさんの今ビデオレクチャーですね、これ終わりましたんで、早速メラニーをですね、お呼びしてライブのQ&A に進みたいと思います。So, Melanie, could you come into the screen? All right.
Yes, I am here.
Thank you for coming to this webinar. We welcome you. Could you quickly do your short intro of yourself?
Yes, my name is Dr. Melanie Davin. I am the Director of the Australian Urban Observatory at RMIT University in Melbourne in Australia, and also currently Acting Deputy Director for the Centre for Urban Research at RMIT University.
Thank you very much.
Thank you.
そう、じゃあ、視聴者の皆さんですね、今、メラニーさん、こちら参加してくださったので、ここからQ&A のセッションに行きたいと思いますけれども、冒頭に申し上げました通りですね、英語か日本語か、それ以外の言語かちょっと困っちゃうんですけども、で、コメントとか、クエスチョンとかを投げ込んでいただければと思います。で、それまでの間、私が最初彼女と話をしながらですね、場を温めていきたいと思います。で、今日見てると、本橋君だな、この去年一緒にRMIT いた彼もいるし、あと桜井先生もいるみたいですね。どんな質問でもウェルカムですので、よろしくお願いします。So, Melanie, I will first ask you a question, then I will juggle between the two languages, English and Japanese. And then meanwhile, I think the audience will throw some of the comments or questions on the chat, and I'll translate to you, all right? My first word is thank you very much for the comprehensive and practical lecture. It's very much bridging the conceptual side, like a social determinants of health, into the more practical use actually in Australia, a city of Shepparton, and those are very much practical information. You cannot get that kind of information in Japan, so it's so educational. Thank you very much. Let me just go back to Japanese. 今ですね、ちょっとお礼を言いまして、とっても、なんて言うんでしょう、コンプレヘンシブって、なんていうか、総合的なね、レクチャーをいただいて、健康の社会的決定要因ってね、ソーシャルデターミナンツオブヘルスっていうそういう理論のところと、それからシェパートンという都市で実際に、使われている情報と両方説明をしていただいて、なかなか日本ではこういうのがないので、大変ありがたいというお話をさせていただきました。で、またじゃあ英語に戻りますね。So back to you, Melanie, my question. So I'm interested in how collaboration between academia and the policy side of municipality or state begun because essentially they are not, they are living in a separate field, but this livability concept is overarching to world, and then it's already demonstrating the collaboration between academia and the policy side. I'm just interested how you began that kind of process.
Yeah, thank you, Tak. It's a good question. I guess part of this, like the rest of life, is about relationships.
今ですね、彼女がいる RMIT と、それから行政の間でどうやって、共同が始まったのか、ちょっと関心があるんだけどっていうことを聞きましてですね、もともとはアカデミアとそれから行政っていうのは別々のフィールドにいるので、これが共同してね、実際にもう結果出してるっていうこともあるので、どうやってやったのって言ったら、最初の答えがですね、これも人間関係なのよねと、そういうやっぱり関係が大切というような言葉がありましたね。So Melanie, I understand that relationship is everything. So, but could you elaborate a little bit more in your case?
Yes, sure. So I think part of it is one, it's nearly like being empathic or having empathy for the practitioners and the policymakers. You need to understand their context and what they're trying to do and trying to connect that to the research.
Okay, so you're talking about the perspective from academia side to the policy side, right? How
Yes.
the academia side looked into the policy side and then became empathetic about what the policy sides are doing. All right.
Yes, absolutely.
まずアカデミアサイドの方からポリシーの方の世界、行政サイドを見たときに、非常にいろいろと大変だったんでしょうね。いろんなことをやろうとしてるんだけども、これはどういうふうに助けてあげたらいいのかっていうようなことを、思いを巡らしたっていう、そういうコンテクストだと思いますけれども、アカデミアの方から助けられないかということで、考え始めたということですね。Okay, could you keep on?
Yes, and also because, traditionally academia was about people doing research and hoping that the policymaker would take up that answer or that great evidence. But that is not the most successful way. I think a more successful way, and particularly for me in terms of wanting to do applied research, is understanding what is the problem that the practitioner and the policymaker have and how can we bring research to help solve that.
その学問のサイドっていうか、アカデミアサイドっていうのはやっぱりリサーチ中心っていうことで、ポリシーサイドっていうのはそういうのを見ながらね、なんかその証拠になるものないかなってことで、それを政策に使っていくっていうのは流れがあるんだけれども、逆にそのアカデミーの方からの、ナレッジっていうかね、ノウハウみたいなものを、どうやって提供できないかなっていうことに、彼女自身関心を持っていたということですね。Okay, Melanie, could you keep on?
Yes, so for me, I am a Melburnian. I know a lot of people here. I have a lot of connections, and that's also very, very important. I couldn't land in Tokyo tomorrow and do this work without having those people who have that on-the-ground knowledge and connections. These are essential to the work.
メラニー自身も、メルボルンの人ということで、地縁というかね、土地ならではの人間の付き合いというか、人間関係があって、そういうものがあったからこういうものができたということで、いきなり東京にって言ってもなかなか私の力じゃそういうところには及ばないしということで、やっぱり地縁の大切さっていうのかな、 それを強調しているということですね。So Melanie, what you mentioned is about the social capital in the academic term, right?
Yes, I guess, yes, it is. But also it's the ability to find people who have similar goals that you have, perhaps in a government or policy setting, and to make that a marriage.
Okay. で、今、こういうのってソーシャルキャピタルって言うんだよねっていうふうに、社会資本って言うんだよねってことを言いましたらそうなんだけど、それに加えて、どういうことをやってる人がいるのかっていうことをこう知るっていうね、ノウフーっていうことだと思いますけども、それもとっても大切だということで、同じゴールを持っている人、ポリシーサイドで同じゴールを持っている人っていうことを見つけ出して、で、それで一緒に共同していくっていうことが、とっても大切なのよということですかね。OK. If you have something to add or
no, I think I just cannot underscore how important I think people are and communication skills and working together. It is partnership. If you want to create impact and outcome, I think that you have to find the people who are making those decisions and work with them.
やっぱりその人間関係というか、それはとっても大切だということで、ちゃんと、意思決定できる人とかね、そういう人と知り合って、こういうことをやっていくっていうことの大切さを訴えていらっしゃったということですね。で、少し質問も来てるようなので、そっちにちょっと目を向けてみたいと思います。So, Melanie, we are getting some questions right now. So, let's take a look at it. The first question is how do the livability and sustainability perspective relate to each other? Do their indicators overlap? Let me just jump in Japanese first. リバビリティとそれからサステナビリティの、枠組みというかパースペクティブ、ものの見方ってことですけど、これはどういうふうにお互いに関係しているのか、お互いにオーバーラップするものなのかっていう質問を柳原さんからいただいています。So, Melanie, could you answer?
Yes, sure. So if you go back to our understanding of livability and the definition of livability, you'll see it starts with a safe, socially cohesive and sustainable place. So sustainability and livability are highly interrelated.
今日先ほどね、メラニーさんのレクチャーの中にもありましたけれども、リバビリティの定義の中に、ソーシャリーコヒーシブとサステナブルというこういう言葉が入っていて、その定義の中にサステナビリティっていうのは埋め込まれているというか、いうことなので、お互いになんて絡まり合ってるっていうのかな、結びついている、相関している概念だっていうことを言っていました。はい。で、その次が、OK, the next question is coming from the same person, but I need to get some additional context for you. Otherwise, it doesn't really make sense to you, right? The question itself is, in what way are livability cities smart? I think this question comes from the context that we are Smart City Institute. Myself is running Smart City Institute, so emphasizing smartness as an organization. But what we are talking about right now is the livability. So how do they relate to each other is a question. And we usually talk about the digitalization as a smartness, as a means of smartness, becoming smarter. But we, as a Smart City Institute Japan, start to look into livability as a way of linking technology as a means to the end, which is the more livability or well-being.
Yeah, I completely agree. I completely agree. And so I would say that, as I said at the start of that presentation, it's easy to be smart, that it's harder to be kind, to be fair, to be equitable, to be livable. But smart definitely has a huge possibility for informing better livability.
Thank you. 彼女も最初のところでちょっと触れたよってことだったんですけども、スマート、テクノロジーを使うっていうこと自体は可能なんだけれども、それがその人に対してカインドだとかね、エクイタブルだとか、リバブルとかって人間のセンスに訴えるっていうところについては、ちょっと違うというかね、もう一段階違う次元だということもあって、ただしそのテクノロジーとかスマートネスっていうのは、そういう、なんていうか人間らしさっていうのかな、そのリバビリティに関わるようなところにも大きな影響力を持ち得るものですねっていう、そういう説明がありました。Thank you, Melanie. Okay, let's move on. Now, the question is from Kudo-san, actually. How does COVID-19 affect your research on livability indicators?
Well, yeah, I can answer that one because it has been really important this year. And one of the first things, I'm sure there are parts of Japan, you've experienced this as well, but in Melbourne, we have nearly had 7 months of being locked down into our local neighbourhoods within 5 kilometres.
クエスチョンの方はですね、まず、その COVID-19、コロナがリバビリティのリサーチにどういう影響を与えたのっていうことなんですけど、メラニーからの最初の言葉はですね、5ヶ月、7ヶ月間ですかな、ロックダウンしてたよね、今。そういう状況に私まず置かれてますという状況の説明がありました。OK, could you keep on?
Yeah, so really what it's meant for us in Victoria, in Melbourne in particular, is that people have come to appreciate their local neighbourhoods. So you will see that I talked about the 20-minute neighbourhood in the presentation, which is current policy for Plan Melbourne. And what happened with COVID is that everyone suddenly had to live the 20-minute neighbourhood. And it was really interesting how people came to appreciate their parks, their local shops, their services, people were walking and cycling.
さっきね、説明の中に20 minutes city っていう説明があったと思うんですけど、これって、歩いて行ける、20分で行ける距離に生活に必要なものが全部ないといけないよっていう、メルボルンとビクトリアの、ポリシーなんですけど、で、COVID が始まってくると、ロックダウンなので、このまさに環境が生きてるっていうことですよね。まさに20分で行けるところに住むっていうところの良さが見えてきてるっていうようなことを言ってらっしゃいますね。Okay, could you continue?
And one of the things, I think it was early April, we have the online journal, The Conversation, which is actually research translated out for a general audience. We wrote this piece immediately, only within 3 weeks, because you see our parks were full. People were talking to their neighbours that they had never done before. So suddenly, livability and COVID-19 became friends. So COVID gave livability a perfect opportunity to show how important the local neighbourhood is.
Okay, thank you. で、結局その、COVID-19 が始まってくると、そのやっぱりリバビリティっていうことで、近くの人とね、ネイバーの人と今まで話したことがなかった人と話してみたりとか、公園が人でいっぱいになったりとかっていうことで、まさにその COVID-19 とそれからリバビリティのフレンドになったって言ってましたけども、そういうね、なんていうのかな、怪我の公務員っていうとちょっと日本語で聞きたいのかどうかありませんけども、そういう環境が持ってるね、リバビリティの良さっていうことを再認識させてくれたっていうことだと思いますね。Okay, Melanie. Could I move on to the next question, or would you like to say some more?
No, that's fine.
Okay. And the next question is from Naoki, who joined us in RMIT with me last year, the PPP guy. Hi, Melanie. Thank you for a great presentation. I'm interested in how you identify effective criteria indicator when you want to adopt the model to different cities in different countries where various living conditions are quite different.
Yeah, that is a really good question. And I think there's some things that are key criteria in terms of sourcing the data being understandable, the data being accessible, the data being reproducible. There's a whole lot of issues around the data that we know they will match from one place to another. But actually understanding the local context, the local culture, and some of these aspects, this is also why it's really important to work with policy partners who know that place and know those people and know those local context factors too.
今質問の方は日本語でね、チャットに書いてあるんだけど、条件の違う国、都市にモデルを採用するときにどういう、ことに気をつけなきゃいけないの、何が有効な基準かっていうふうに判断どうやってやるのっていう質問が、ありましたけれども、で、そのメラニーからの回答としてはデータの、アクセシビリティとか、なんていうのかな、データがあるかとかね、それからそれをどう解釈するかとか、どう使えるかっていうところも、そのローカルの、その現地の、中で制約とか文脈もあるし、それからポリシーそのものも、やっぱり文化とかね、風土とかっていうのに左右されるっていうことがあって、そういうコンテクストみたいなの分かる人とつながらないと、やっぱり何がいいかどうかっていうのは分かんないよねっていう、そういう説明がありました。Okay, Melanie, would you Yeah, keep speaking.
Yeah. So there is an article, a paper we published a couple of years ago now, and it's called Best Practice Principles for Indicator Systems. And some of those things, there's actually a whole heap of points in there that really are going to directly apply for many places. I would be happy to share that paper. If anyone in the audience or if this person was interested to share, I could provide that to you. And also the important point that indicators are really like the tip of the iceberg. And there's a lot happening underneath that will explain, well, why is that happening and what should we do about it? So it also explains that detail in it.
ですね、2つ今回答というかコメントがありまして、そのベスト、インディケーターのベストプラクティスについて書いたペーパーがあるんだって。で、それがやっぱりなんていうかな、今ね、本橋さんがくれたような質問のように、どういう時にどんなものを使ったらいいかっていうか、いろんなそういう経験則が書いたものだと思うんですけど、これをシェアできますよ、希望があればシェアしますよっていう話ですね。後でいただきましょうね。それと結局インディケーターってティップオブアイスバーグって言ってましたけど、氷山の一角っていうことなんですけど、その水面下にいろんなものがあるので、結局その上だけ見るんじゃなくて、その下にあるものっていうものは大切なのよねという説明でした。Okay, Melanie, thank you. Let's move on to the next question. The question is from Kikuchi-san. Is the livability indicator like kind of a city ranking, focusing on the health side of the living condition, and it is consisted of number of quantitative indicators, element by element? Is that the way we understand your framework?
So when it comes to, we do have a livability index that is like an overall index of all those different domains of livability. That's first point. Maybe just say that first.
で、まずリバビリティのインデックス、総合指標ね。これはいろんなそういうものを総合化したものなのよっていうことです。Okay, let's move on.
Yes, but at the same time, that index and the way we conceive of these indicators, we want them available at the neighborhood level because we want to look at intra-city differences, not just inter-city in terms of city comparisons. So the Economic Intelligence Unit talks about livable cities, but they're not interested in where the inequity is. Where are the people doing better or worse across the city, which is what we're interested in. We want to see what's happening inside the city and identify the areas that need greatest intervention to lift those people so they have more livable areas.
とっても今大切なことをお聞きしているんですけども、そのね、インデックスは総合指標なんだけど、それが、分解した時の行く先なんだけども、流度というか、これがね、ネイバーフットっていうレベルだっていうことなんですよ。で、これ、ネイバーフットって日本語ですごく、訳しにくいんだけど、街区とかね、いう言葉になるかなと思いますね。行政単位としての市っていうのがあって、その中に何丁目とかね、なんていうか、より細かい分野があるじゃないですか。そこまで見ていて、で、都市間の比較じゃなくて、都市の中の、その町の中の、町対町の比較っていうのかな。そこに着眼していると。で、要するにマッシュアップしちゃったレベルで見ると、どのくらいエクイタボーっていう言葉を使ってましたけども、格差がないか、公平か、公正かみたいなものってなかなか見えないんだけど、実は関心があるのは、その市の中の町の単位で比べたときにどのくらいギャップがあるかっていうところに、重きを置いているっていうことでした。Okay, Melanie, go on.
Yeah, so I would argue that actually an index is less valuable than a specific measure because the specific measure, as an example, you may look at walkability across a city. And you saw within the Australian Urban Observatory, we can look at neighbourhood level results. If I look at neighbourhood walkability and I'm a planner, or I work in a local government and I want to improve walkability, I can identify those neighbourhoods that are doing poorly and try and make sure that my interventions are going there first to improve walkability rather than just sort of taking a stab in the dark and thinking about, well, maybe I'll do a bit here and a bit there. We want tailored, targeted intervention.
はい。ですね、要するにそのインデックスレベルというよりも、その総合化したね、指標というよりも、もっと分解した細かいレベルのところに数字の価値っていうのは実はあるのよと。 で、例えば、ウォーカビリティって言ったときに、市全体でウォーカビリティで見ちゃうとこう平均化されちゃうから、どこにどういうこう強み、弱みがあるかっていうのは分かんなくなっていっちゃうんだけど、ネイバーフットレベルでそれを見れば、よりこう具体的な介入、インターベンションという言葉を使ってましたけど、政策の立案とかね、政策の実行とかってことだと思いますけども、これが可能になるということで、やっぱり細かさ、流度っていうのがとても大切だっていうところで、いわゆるランキングとは違うっていう、そこに差があるっていうことかなというふうに思います。Okay, do you want to add more? That's it?
No, I hope that's answered it.
Okay, yeah, I think so. Yeah, right. Thank you very much. Alright. で、視聴者の皆さん、今ですね、いただいている質問は全部大体舐めましたけども、いただきましたけども、他に何かありますかね？ And one more comment from Naoki. So, thank you. Totally agreed. Look forward to meeting you again. Yeah, me too.
Thank you. Arigato.
これね、最近僕逆指名する癖がついちゃってましてですね。まだあれ、桜井先生いるかな？いなくなっちゃったかな。桜井先生がいなくなっちゃったかな。あと、昨日、藤井さんいつもFacebook でも、フォローしていただいていて、大切だね、ボタンを押してくださっていて、僕も感謝してるんですけど、なんかもし質問かコメントがあればいかがでしょう。それから、エグサさんから質問が入ってます。ちょっと飛ばした。本当だ。成功したスマートシティを最終的に判断するは、住民の満足度によるものかと思いますが、そういった分析はなされているのでしょうか。One question from Exa-san is that we assume that the final assessment of the smart city is that whether or not the citizens satisfied with the city. And, do you conduct similar analysis of the cities?
Yes, well, interesting, wasn't it, Tak? We were talking earlier, and you had talked about some of those survey level data available in Japan that we don't have. It's very expensive here to run large surveys, and this is what we did in the past. Back with Community Indicators Victoria, you saw that other project. We would do large-scale surveying across all of the areas of Victoria, but now it's just so expensive to do it, and it's really difficult to take that information and collate it down. But with mobile phones and so on, the technology has changed now. It's difficult to do it, but I definitely agree that this is something that is the best way to operate. And if we can include objective measures with subjective measures, that is the gold standard in my opinion.
Thank you. 今ですね、メラニーさんからあったのは、そういうの大切なのよねっていう、実は今日ね、始める前にその話をちょっとしてたところだったので、そういう主観的な評価っていうのはとっても大切なんだけど、やっぱりサーベイってアンケートってやるのってものすごくお金がかかるんですよね。だからなかなかできないっていう制約があるんですよね。だけど、ゴールドスタンダードっていう、なんていうのかな、黄金比率っていうのかな、わかんないけど、ベストプラクティスって言った方がいいのかなっていうのはやっぱり主観と客観と両方をちゃんと評価することですよねということでした。And then I got the next question. 徒歩20分以内、多くのサービスというのは比較的大きな都市のみに適用できるような気がします。僻地では難しいと思うんです。Okay, I got the comment actually, not a question. So he is referring to 20-minute city concept. And then his opinion is that that idea is applicable to fairly large cities only. If it's a very small city in a very rural area, it's not really feasible. So I think he's making comment. It's not universally applicable.
Yes, and I do agree. Like I had said in the presentation as well, I've been doing a lot of work with regional cities. And, when you come down to smaller regional cities, of course, this doesn't apply. And talking about it is very frustrating to those smaller regional areas as well.
メラニーさんもそうなんだよねということで言っていて、まさに他の都市でね、リージョンって言い方してましたけども、僻地という言葉が正しいかどうか分かりませんけど、田舎の方になってくると、そういうウォーカブルシティの話したくてもできないので、ちょっと残念なのよねということをちょっと言ってました。藤井さんどうもありがとうございます。インデックスとコンテクストの違いが曖昧でしたので、理解できました。 共通のコンテクストを洗い出していくプロセスが大切なのかなという感想を持ちました。ありがとうございました。So another comment, not a question again, is that she is convinced between the difference between index and context. Right? She was wondering how they are different, but now she's clear about the difference between the context and index. Number and
yes, and I think this is really important. It's that idea that there are some things. This is what I have found. There are some things, even across the world, that we all agree are important. But then there are other things that are less so important. They have a very different understanding or perspective in a different area. So that is the context of how we're applying it. An index is a statistical term.
そうですね。インデックスは統計の用語っていうことなんですけども、ある文化では重要なものが他の文化でもね、そうじゃなかったりもするので、そういうことを理解するのがとっても大切ということなんですけども。で、so Melanie, so her comment has another part, which is she is now convinced that the process of identifying the context,the process of finding out context seems to be very important. And,
yes,
right.
I would definitely agree with that. And this is where I think I would refer to it as local knowledge. So it doesn't matter what skill, ability, technology we have. If we're not talking to people with local knowledge, then we're not making that connection to place and to people.So there are some things that will apply and some things won't, but this goes back to that very first question. And I talked about the importance of communication and relationships and working with the people who know that area.
Thank you. で、結局その地元、なんていうか、ローカルナレッジっていうのは地元のね、に関する知識っていうところが欠けちゃうと、ダメなのよね。とっても重要だってことで、藤井さんのおっしゃってることを、エンドースしたようなことを、今メラニーが言っていて、いかにその数字とかテクノロジーとかっていうのも、大切なんだけども、それ以上にやっぱりそういうローカルナレッジっていうのが重要で、かつ、その、なんていうのかな、もう冒頭に私も言ったでしょって言ってましたけど、コミュニケーションっていうね、リレーションっていう言葉言ってましたけど、その地元の人とのコミュニケーション能力とか、関係を築くっていうところがないと、こういう分析とか提言とかみたいなのできないっていう、そういうことをおっしゃってました。Alright.
And Tack, if I could just make one more point to go with that one also, is that I think that indicators also are the start of a conversation.So that's how I would describe them, as conversation starters. So even if maybe this result doesn't apply perfectly, but you can use the data and the information to start those conversations with the people and the community too.
I totally agreed. ですね、今メラニーから追加のコメントがあったんですけども、インディケーターってね、さっきはこう数字なので、ローカルナレッジがないと始まらないっていうことを言ったんだけど、逆サイドでインディケーターがその地元の人との対話を始めるための道具にもなるよねと言っていて、初めからパーフェクトなものなんか作れないんだけど、それを使って、地元の人と話を開いていく、会話の扉を開いていくっていうことにもなるので、そういう使い方ができますよねということをおっしゃってました。はい。And one comment. Thank you for the comments. It sounds like we should begin from where we can.So start small and we can grow later.
Yes, absolutely. We have a saying, there is a song here that is very famous in Australia. It is called From Big Things, Little Things Grow.
なるほど。
From little things, big things grow.
Yeah, that makes better sense.
Sorry. It's late here.
同じことを言ってました。できるところが小さいところから始めて大きなところができるようになるっていうね。大きなものも、だから万里の道も、なんとかみたいなことありましたね。そういう言い方ですね。最初の一歩は小さいんだけど、やってるうちに大きくちゃんとなっていくよと、こういうコメントでしたね。So, Melanie, thank you very much. I think we covered all the questions from the audience, and it's so educational and informative, and we all appreciate your presence.Thank you for attending this webinar. We are now closing this webinar. Thank you for attending again.
Oh, thank you very much for the opportunity and being able to speak to everyone today. Thank you very much, Tack.
Thank you. OK。じゃあ、土屋さん、これで終わりますので、いつものご説明をお願いします。
はい。事務局の土屋です。今日もご視聴いただきまして誠にありがとうございました。最後にですね、簡単に今後のウェビナーのご紹介を日本語でさせていただきます。申し訳ございません。今日ご視聴いただいた皆さんにはですね、この後 PTX から、PTX じゃないですね、Zoom の方からアンケートが飛びますので、ご回答ご協力お願いいたします。それから今後のプログラムですね、こちらのホームページ PTX、それからこれまでの動画は YouTube の方で公開させていただきます。YouTube の方のチャンネルもですね、ぜひフォローしていただけるとありがたいです。で、今後の予定でございますが、今週はあと1日、明日ですね、明日は三菱総研さんですね、の方、研究員の方に地域ポイントの可能性についてコメントいただきます。それから来週もですね、月曜日は三菱総研さんですね、ロケーションデータの活用というようなことで、いただいています。それから水曜日ですね、スタートアップエコシステム拠点都市ですね、今年選定されましたけれども、こちらのご担当のですね、石井企画課の方にご紹介いただきます。あとデンマークのデジタルガバメント等々続きます。その翌週もですね、ここに示しますように、いろんなテーマで盛りだくさんのウェビナー企画しておりますので、ぜひご参加いただければと思います。それからいよいよ今週金曜日に迫りましたスマートシティアーキテクトの育成イベントですね。こちらの方まだまだ受付中でございます。多くの皆様のご参加をお待ちしております。で、私どもスマートシティの紹介はもう何度もお聞きいただいている方多いんじゃないかと思いますが、設立2年目ということで、会員数も今350に迫っているという状況です。で、会員制度の方もですね、こちらに書いてますように、地方自治体、それから非営利の団体様、無料でご参加いただけますので、ぜひご参加をということと、個人でフォローという場合にはですね、Twitter、Facebook でフォローしていただければというふうに思います。はい、私からのご案内は以上となります。それでは本日も長時間にわたりましてご視聴いただきましてありがとうございました。メラニー、Thank you very much。
ありがとうございます。
ありがとうございました。バイ。
Thank you.
Thank you. Bye.